hi guys, this is Slyjay here. This is Connekt Media. We're back again, we edit again. Botshilu Private Hospital, Dr. Mfikwe, Dermatologist. Kacheko, Rebolelaka Melasma. If you want to know what Melasma king, Skatamaya, Skasuta, stick around. Ardumbelega Mahare, I can refer information ya hore Melasma king. Retsene. Hello, hi guys, this is Slyjay from Connekt Media, and it's yet another beautiful day. Today, it's a topic massive too much. Topic especially most fatle home. Also, but today, why Connekt Media podcast. I have this beautiful doctor today. Let me not waste time. How are you, doctor?
I'm good, and you?
Doctor, how are you feeling?
Oh, thank you. I guess it's God's grace.
Hallelujah. But I can not
No. But thank you.
Okay, doctor, please introduce yourself to our viewers today.
Okay, Nagina Dr. Mfikwe. I am a dermatologist practicing here at Botshilu BMR Clinic, Family Clinic.
Okay, let's start here, doctor. This whole thing is me guy. I mean, can I not do the you know, maybe lawyer, you know? So why did you choose this one?
Ish, yeah, maybe it chose me.
Oh, okay.
I don't know. But I started, obviously, high school. I was doing science subject and mathematics. And then when I completed my grade 12, I went on to study Bachelor of Science.
Okay.
So then completed the Bachelor of Science and decided, hey, maybe I should go get a job. And my dad was like, no, why don't you think about going? Because initially I wanted to do physio. And then my dad said, no, why don't you do medicine? And then I applied, accepted into the program and finished my degree. Then later on, I worked for a while as a general practitioner or medical officer. And then after some time, because I was exposed to a lot, I did an HIV program at the clinics, exposed to a lot of skin conditions. And I was wondering, you know, they come present in different ways, but you actually cannot tell because we don't do much of dermatology as undergraduate. That's what interested me. And I applied. Fortunately, I got accepted, and here I am today.
Yeah, doctor. I think because today you are here,
No, yes. My parents did play a big role in my career. And, you know, my father and my mom always influenced us to get education, you know. Mamaga was that person who will tell you, if you are a woman, yes, have your own career, have your own money and work. Yeah.
Okay. Doctor. I'm sitting here, Mopitori, and Mopitori, you know language Mopitori.
Yeah, Mopitori.
Mopitori, doctor. Now, Redumbela Tata Mosque.
Okay.
Redumbela Tata Mosque, Recopana, Lelefukushili Barge Melasma.
Okay.
Someone confused the Hatalohanyo Ribuakai. Can you please tell them what Ribuaga Melasma, Ribuagai?
Okay. Melasma is an acquired hyperpigmented skin condition that occurs on sun-exposed areas, right? It's got a synonym name that's no longer used much, which is called kloasma. So the Greek came with this word kloasma, and kloasen means green, and melas means black.
Oh,
so because it becomes more darker, we are settling on the word melasma.
Oh, so 1, 2, that's the
yeah. Then we ended up with the latter part of the word.
Okay, now doctor,
like I'm saying, it's an acquired type of hyperpigmentation. It's called by sun exposure. So when you are exposed to the sun, let me say UV radiation. When you are exposed to UVR, your skin has these cells called melanocytes.
Okay.
So your skin is made up of 3 layers: the epidermis, the dermis, and the subcutaneous tissue. So between the first and the second layer, this is where we find melanin, right? Like how you look is because of the number of melanin that you have, or the type of melanin that you have. So at that area, that's where you find it. And these melanin also work as your chromophore. So what happens is when you are exposed to the sun, there's a process called melanogenesis. It produces this melanin that comes and protects your skin cells so that you don't get sunburned. That's why people of darker skin color don't get sunburned like those who are of fairer skin. So the more you get exposed to the sun, the more you influence this process of melanogenesis, and that ends up with hyperpigmentation. As to exactly what happens, why is the hyperpigmentation on sun-exposed areas, and why doesn't it occur in other areas? It's still under research, but we know that it occurs in sun-exposed areas. It can be centrofacial, meaning on your forehead, your cheeks, your nose, the upper part of your lips and your cheeks, or it can just be on the malar area. Malar area, I mean your cheeks and your nose, or just mandibular, around the mandible. But also sometimes on rare occasions you can also get it on the upper part of your body.
Now, doctor, how dangerous it is?
Not at all.
It's not dangerous?
No, it won't affect your lifespan or anything like that. But the only problem with melasma is it will affect your quality of life. If you have melasma, you might be shy to present yourself in front of people. When you have a skin condition that's there in front of everyone's eyes, you sometimes think that once you're talking to someone, they're actually looking at your melasma, whereas it's not always the case. So people get depressed, or let me say mentally affected by the fact that they've got this hyperpigmentation. And remember, you don't grow up having melasma. It occurs later on in your life, usually during the reproductive years. And it also affects women more than men.
No, doctor, I personally think it's dangerous too much because it affects a relationship here. How?
It can, in a way. It depends, Depends. That depends on it's a lot. It
depends on the relationship.
Yes.
Because we know we have renalaba to by long hore okopane le motho and then oratile motho ka se a se bona, and when that changes in our ntula I boning I teng, and then
so true, because now you have to present that person to you. You've always gone to do things together, but then it also will affect the person who has it in a way.
So I think it's very important for us to have this conversation, because we'll also be able to help batho ba tshwanang le bona bao, because ha fitla mo situation se tshwanang le seo ha itse hore a se handle le bjang a dile le sona bjang ba tlwaetse mo lomba botlhe ba sa tsamaya ba botlhe ha sa khona hore a mo lebela ha sa khona hore a mmotse am calling handsome or ka mo calling pila ka teng, so I think it's important for us hore re be le this kind of conversation.
It's so true, I agree.
Guys, I'm still chilling with the doctor here, and I'm learning as I always learn, and I believe for learn you're learning. If you look hore go jardeng on na le motho le hore ona le yona flopo today he re na re khaohana mo o tla be go itse gore tshwantse wetse e re no metsi ra bo. Welcome back to the show, guys. Richitsile Dr. Mo, and we're talking about melasma today. All right, kita questioning Dr. Ne. We have a few questions here from the viewers, but before questioning, before the break, let's say hore e affecta batho ba basadi thata. Why is that?
One of the causes of melasma, they say it's hormonal.
Okay.
And it presents more in pregnancy women.
Okay.
And with women who are starting on oral contraceptives as well. So, yeah, we think it's more hormonal, and even statistic-wise, it's like 9:1, men to women to men. And the other thing, besides the UV radiation, hormones and stuff like that, it can be genetics as well. So if your parents, especially your mom, has melasma, the chances that you can also have melasma.
Oh, okay. No, doctor. He no bolela bia o kentse mola ke nahana hore mara oh maybe makeup, because I know hore basadi ba rata makeup too much, ke nahana hore maybe doctor tlo no makeup lona o na le bothatanyana ba e cause ndenge se e wa bona. So if lo makeup ba we cause, then I horror ne re safe, doctor Gera.
Actually, makeup is a treatment, sort of treatment, because
Serious?
it's a cosmetic camouflage. So if you have melasma, and it sort of makes you feel otherwise, you can use makeup just to hide it away.
Doctor hape re ba le flop ba no. Hapa ke re o itse re batho ba kopana ka tsela tse farologaneng, you know? Peter o so kopana le Cynthia ko kai and then ba utlwana o phela a mmona a fakile nneng se mo sfatlhegong, then ho fitla that part ya hore ba khona hore ba be together till the next day, you know? So Petros the next day o bona motho mo different ha bone o la nantse a mmona all this time. So unless if Lord maybe Cynthia o tla mmotsa nako e sa leteng hore e shwetse ke ngena le flopo e so he ke tlose ding se mo sfatlhegong o ka bona dilo tse so don't be surprised, because magala motho furu ha tsoha o butsisa motho ana leng yena hore motho ne ke na le yena mabane o kae ka ba wa tlaloganya doctor ne?
No, okay, it's hard.
All right, doctor. At the questioning, we have Dorcas. Okay, Dorcas, the questions are how to already, Doctor Odi Arabil, especially what exactly is melasma and what causes melasma to appear on the skin. Doctor. Okay, number 3. Are there specific risk factors for developing melasma?
Yes, like I've mentioned.
Yes.
Pregnancy, oral contraceptives or some medication, and sun exposure.
Okay. Mavis, how can we prevent melasma?
Okay. A good skin routine is how you can prevent melasma. So good skin routine, I'm talking gentle cleanser on your face, then you moisturize and you apply your sunscreen. And remember, when you apply your sunscreen, you must apply it adequately. So you must apply like a quarter of your teaspoon on your face and neck, meaning a full length of your index finger and your middle finger, like, you know, then it will cover your face and your neck. And if you are more in the sun, you must reapply every 2 to 3 hours. Actually, even when you have melasma, that's a basic step. Try and get yourself an SP sunscreen of a sun protection factor of more than 30 or 50 if you can afford it. Make sure you apply enough in the morning. After you apply it in the morning, you wait for 15 minutes before you go and expose yourself to the sun. And then every 2 to 4 hours if you can, especially if you are running or you are swimming, immediately after that you reapply again. So you must keep on reapplying. Unfortunately, we live busy lives.
Yes.
I know some of these things that I'm saying might not be possible for you. And yeah, that's how you prevent it, by just having a good skin routine.
Okay. Ke rata ka ba ha doctor, because the questions are Heidi already level bedi we arabile. So are there any lifestyle changes that can help in preventing melasma?
Well, lifestyle changes is always make sure you have, because it's sunscreen,
Yes.
you make sure that you always have a hat or an umbrella, and it must be a wide brim hat. And remember, the earlier you start, the better. So a sunscreen is something that you can use from the age of 6 months on your child. You just have to choose the relevant ones for your children. And then you must continue with that lifestyle until you are done. And try not to expose yourself. Like things like tanning beds, I think they're not longer available because they have noticed their dangers. So when you are in the sun, make sure that you protect yourself. Yeah, it's as simple as that. And also, the earlier you see that you're starting to develop hyperpigmentation, just go and consult your dermatologist.
Okay, I have Puti. We have a few questions from Puti. I think you also touched on this, but get with this anyway. What skincare routines is recommended for people with melasma?
So, that's treatment. Now that when you have melasma, there are many different ways to treat melasma.
Okay.
So the most important thing is go and see your dermatologist and come up with a treatment that can be suitable for you.
Okay.
Because I can use different treatments on different patients, right? And don't expect miracle. Remember, melasma doesn't just go and the whole face, it's dark. It's insidious in terms of how it develops on your face. And you, so even to treat it, it takes time. And we don't respond the same way because, as I said, it's the pigment cells on your skin. So it can be, those pigment can be on your epidermis, which is the top layer, or the second layer. And in terms of treatment, it depends where it is and how quickly you will respond to it. So there are different modalities of treatment that we can go through.
Okay, another question from Puti. Are there any over-the-counter products that can help treat melasma?
You know, I think the best way to treat melasma is to go see your dermatologist.
Simple.
Simple as that, because it's not the one-go treatment. Yes, of course, there are over-the-counter retinol creams that you can use, antioxidants that you can use, and all those things that they say they will clear your melasma. But they can be good in a certain way, to a certain extent. But most of the time, patients come in, they have tried everything, and at the end of the day, they've spent a lot of money. That's what they complain about, and the melasma is not going. But
Yes.
all they needed to do was to go see a dermatologist, have a certain, and remember, the dermatologist will tell you and advise on what to use and how to treat it. And when it clears, don't stop.
Yes.
Because it recurs. So you need maintenance therapy from there on.
Okay. Your answer again answers this next question. What medical treatments or procedures are available for melasma? So, answer ya matom isa boela hape mo yona e hore. Tsama o ile bona mandenge sor papa ndenge because ke bona ba berekang ka tsona. And I think that helps because renal difference, you know, and the whole until lithomitsa how ba botsa kana problem eso. Hey, hape rena le doctor tse leng hore a ba qualified ba tla botsa hore no tsasa eng tsia seretse e tsia engwe kopantse le eng, you know, and then o makala o ba we, so ho important hore o consult motho le ngore wa itse hore o bereka ka tsona.
Yes.
Thank you so much, doctor. Let's continue. We have Pam are how do hormonal changes like pregnancy or birth control impact melasma?
Yes, it does. It will worsen it actually if you
Oh.
have pre-existing melasma, because it causes it as well, right?
Oh, okay.
But I mean, if you want a baby, you will have a baby. We can advise on what to use, and most of the treatments that are there for melasma, you cannot use them when you are pregnant.
Okay.
So if you see your doctor, he will advise on, like azelaic acid is one of the things you can use whilst you are pregnant. And sometimes after the postnatal period, patients clear, but some it persists. And or it clears, and with the second pregnancy it recurs. So it varies from one person to another. And if it's caused by oral contraceptives or certain medications that you are on, we
Yes.
will always advise you to use alternatives in terms of that.
Okay, last question from Pam. Can hormonal imbalance worsen or trigger melasma?
Yes, it's true.
It can.
Yes.
Okay, another question. What can pregnant women do to manage melasma during and after pregnancy?
Back to that answer that I gave. Go see your specialist. They will be the best to advise you on what to use. You know, I don't think there's a very simple, and the routine that you'll be using will advise on what antioxidant to use, how to use them. And I don't think there's a simple answer to that question.
Yes.
Because there's many things. There's topical medication that you can use. There's oral medication that you can also use laser therapy. You can also use chemical pills. And in other instances, you use 2 or 3 modalities together to get the best outcome.
Okay, Doctor, I'm looking at those questions, ne? And because the romets with the thing, le he karabo e ka nna e one. Ke tlo no tswella pele ka di bala, because I'm looking at some of the questions tse ding o di arabile and tse ding di re busetsa ko yona karabo la hore consult.
Yes.
You know, because we have bontle what's the best type of sunscreen to use for melasma? For melasma prime skin. So can I handle we arabile?
Okay, there are 2 types of sunscreens, right?
Okay.
We have chemical and physical blockers. So the physical blockers are the ones that are good for melasma. So they contain titanium oxide, zinc oxide as well. So titanium dioxide and zinc oxide. So those are the best ones that you can use for melasma. And it must be with a SPF of more than 30. If you can also go to 50 as well. Okay.
Doctor, hona le question e nngwe long hore wa itshabela mara nga se botsisi yona one, because re utlwane hore nga se botsisi yona, but ke tlo re botsisa this question since re bolla ka di sunscreen. Do you think me and my director here ra tlhoka hore re berekise sunscreen?
Everyone should use a sunscreen.
Or everyone?
Everyone.
Okay.
Regardless of your skin color, your skin type. Like I was saying, remember that question that says, how do I prevent? So everyone should use a sunscreen, whether male or female. Should be your routine. Cleanser, gentle moisturizer on your face, and a sunscreen.
Olega problem ela ya ka ela waiting.
No.
Ikasi
tusi, but you need a sunscreen as well.
My director, I hope you're listening. Anyway, it's fine. Let's continue with the questions. We're still on Bontle Are. How often should sunscreen be applied to protect against melasma?
Well, if you are genetically predisposed to having melasma, you might have melasma. But the good way of using a sunscreen, like I said, it's a 1/4 teaspoon for your face on your neck, and you can also use on sun-exposed areas as well. And you should apply it in the morning, 15 minutes, let it settle on your face, on your skin, and then you can go to your outdoor thing. And every 2 to 4 hours, reapply.
Okay, you mentioned it's A2. This next question. Can you recommend sunscreen brands with high SPF for melasma? You mentioned let's say 2, so I don't know if you can maybe.
In terms of brands, I cannot recommend,
Okay.
So, but yeah, SPF over 30 or of more than 30 is what we recommend. Okay. Because as all the sunscreen, regardless of their brand, they do they do say whether it's a 30, a 50, or more than, or plus 50. So you choose which one you think. And you can always, when you go looking for a sunscreen, you can always ask them for a sample or whatever, apply it on your face, because sometimes you might have that white hue that people are always complaining. It gives me a white hue. So you can always ask that they put it on your skin, and you can see if it blends nicely into your skin.
All right. To our viewers, let's come and noise bathong. Botshilu Private Hospital. So obviously, movement eko munchi, balwetse ke ba bantshi, batho ba ileng gore ba tlhoka thuso ka difatlhego, batho ba ileng gore ba tlhoka gore ba isiwe ka mola ka mo theater ke ba bantshi. So don't be surprised once o utlwa di footsteps kgotsa o utlwa noise e itseng. Ke re ke fitisenyana ka pela Dr. Agere. Okay. Thank you. All right, we have done does diet play a role in preventing or managing melasma?
Not really, but like any skincare, we always advise that you must have a good diet.
Yes.
There's been some, saying that sweeteners, artificial food, which are artificially sweetened, can worsen the melasma. But to be honest, I haven't seen much of research in that area as well. But for everyone, a good diet is always better.
Plus I got hard with you hanchi but la botsa dijo tse di tshwanetseng maketse a ke re kwa le re ja diphatlo di Russian di Viane hey doctor nako ngwe di ntsha le di skore like dilo tse dintšha akere ba re mafura a mantši. All right, and another question from Don RM. Okay, ashi engwe are there foods or supplements that can help improve skin health?
They are there, but it will be based on your skin condition.
Oh.
Yes. It will be based on your skin condition.
So bola go consulting happy. Yes. All right. Last question from Don Are. How does stress yeah.
Actually,
it's doctor Mark stress.
It does.
Yeah.
It actually you can finish your question, but
hey, doctor, whatever to stress, they look horrible sometimes. How does stress affect Melasma, and what stress reduction techniques do you recommend?
Yeah, that's not my area of expertise, but stress can worsen melasma and can induce melasma. So I guess there are mental health specialists out there who will tell you how to manage stress. And remember, stress is a mental condition, depression, let's say. So, and there are people who deal with depression. And sometimes, we see it as a taboo, but actually it's a good thing if you feel depressed to seek medical help.
That is why we le for or by lot of fozanyana ba go tshwara ka massage nyana ba go relax wa ikutlwa na ho fetsa ho utlwa mano kare hona le morwalo nyana o utlwisitseng mo mmeleng wa ha o le tlhaloganyo ikono na hana pila.
So true.
All right, doctor, we also have Amza here. Are there natural remedies or home treatments that can help with melasma?
Okay, so as a medical specialist, I will always advise medical treatment. Because home remedies, yes, they are there. When you go on to Dr. Google, he'll tell you a whole lot of home remedies that you can use. But it's always important to consult people who know best about your condition.
Okay. Yeah, Dr. Wetsegeng. Mafoko a lona ana le ane denga market lono le bala doctor we no tla le lokisa ke sa le bala pila. Rasalmo Amza are what about skincare products with ingredients like vitamin C or licorice root for melasma? Ke yona ne?
Yeah.
Oh, hey, doctor, hape o ka re sala o tlo mo tshwara pela ka dithangs, you don't understand, but yeah, ke ba dile.
Yes, those are the things that some products do actually incorporate that, and there's vitamin C serums that people can use. They are antioxidants. By the way, when you are exposed to the sun, you release oxygen species, reactive oxygen species, that also worsen the melasma. So when you use a vitamin C serum, it's sort of an antioxidant and helps in that process.
Okay, we also have Tapelo RM. How long does it typically take to see results from melasma treatment?
I would say give your doctor at least 3 to 6 months to see any changes. Yes.
Okay, and again, can melasma be completely cured, or it is a condition that requires ongoing management?
Yes, it does. It does.
So high glow?
No.
Oh, but I think
remember,
you mentioned it earlier. Yes.
Remember, if it completely clears, it can recur. So you need ongoing management in terms of how to handle your skin going forward for preventative purposes.
Okay. Last question from Tapelo RM. What should one expect in terms of improvement when seeking professional treatment?
Well, it should be, we usually take pictures at the beginning of treatment so that you can see is there improvement or not.
Always, yes.
But most of the time you will see improvement as, monthly, depending on how often you take your pictures, that there is improvement. And like I was saying, remember I said the pigmentation might be a problem in the first or second layer. So of course, if it's in the second layer of your skin, it will take longer time to clear.
All right. Okay, we have, I think this is the last, these are last questions from Jewel. Jewel are do different skin type or ethnic, modimo akotso. Dr. Mafoko a lona a heavy yo. Ke rapela fela gore ke ska rohana. The different skin types or ethnicities, okay, ethnicities, yes, ke yona ne?
Yes.
Okay, have a higher risk of developing melasma.
Yes, it's patients of more darker skin.
Oh,
Yes.
okay.
Are the ones who struggle more with melasma than the ones with lighter skin color.
So rena ba
No,
leng
in
darkenyana
terms
re?
of, yeah, rena ba ba dark.
Dr. Arren.
Yes, all of the darker skin type. So
Okay.
we have what we call, we classify the skin color according to Fitzpatrick's type of skin. There's 1, 2, and it depends on whether you burn or you don't burn, not necessarily how you look. Yeah, so patients of more darker skin colors do experience more melasma than the fairer skin.
Ash, ke ba dizzynyana, Doctor, but I think o ka nthusa because hantši lo tsama ko toropong ore mo tle mo kopanang le batho ba leng hore maybe let's say ke makgowa, you know, o khona bona masfatlheng gore o bone o iputsise gore hantši ba leng hore ke ba bona, especially makgowa o na le bona man mo sfatlheng gore no man o ka re ha skin sa a se right.
How? What do you see?
No, a ke re bona ba bonagala ka pela, so o kere o ka re o tletse bodiso mara a se diso mara sfatlhego se se na le dotto tse dintšhi tse red or ke letsatsi or what, I don't know.
Yeah, they usually, most is solar line type, or
Oh,
it's a different type of hyperpigmentation that you see there.
okay.
Yeah.
Oh, okay.
Not necessarily melasma.
Okay. All right, Doctor. Rosalamo Jewel, are there variations in how melasma appears on different skin tones?
Not necessarily on different skin tones, but there is variation. Like
Okay.
I was mentioning, its distribution, right? I said it can be centrofacial, meaning the forehead, the cheeks, the nose, the upper part of the lip, and the chin. Or it can be malar distribution, your cheeks and your nose. Or it can be mandibular, you know, mandible, along the mandible. And it's not according to what skin tone you are.
Okay.
And also melasma can be reticulate, meaning net-like. If you look at it, it's not a patch, it's like a net-like. Or can be punctate, like, you know, dots, dots, dots. Or it can be confluent, meaning it's just diffuse.
Yes.
Your whole cheek is diffusely hyperpigmented. But that is not because of your skin tone.
Oh, okay. Last question from Jewel. Is treatment different for various skin types?
Not necessarily, but like lasers, in a darker skin type, sometimes it can burn them, but these days we have good laser therapy for that. But we mostly treat the same. Like I was saying, I'll treat patient A and patient B in
Yes.
2 different ways. You know, like how severe it is it mild, is it moderate, is it severe? So you'll choose a skin routine or a skin treatment that's different from one patient to another.
Okay, Doctor, that was our last question. But I think we have people out there, by Longkore, they have more questions, you know. So I don't know if you're on social media or if they have questions. Doctor.
Well, I am at BMR, like I said.
Yes.
Here in Soshanguve, number 68, Block DD, at the 4-way cross.
Yes.
Yeah, that's where they will find me.
Oh, you're not on social
I am
media.
on Instagram. They can also.
Almost hey, Doctor Musu. Hey, somebody now. Our Facebook, my Instagram.
Yes.
Mo Instagram ke mang?
Ke Dr. Mfikwe.
Okay. Your last words to our viewers.
My last words to you, the viewers, I can advise you this. good skin routine is the best thing ever. Start using your sunscreen early. I'll repeat myself, a gentle cleanser, a gentle moisturizer, and a sunscreen. And use it adequately. Use enough to cover the face and the neck, like I have explained. And if you can, repeat it. Something that I didn't mention much, I talked about UV radiation. And some patients will tell you, but doctor, I don't always go out in the sun. I always say to them, if you're in your house, what do you do during the day? Where do you get the light? And they say they open the windows, and I go, there's your sun rays coming in. And another thing, visible light also. It has shown that it's within the UV range of UVA. So it will also accentuate or cause melasma. So even if you are saying, I'm always indoors, but you're in front of your computer or visible light, please use your sunscreen.
Okay. Guys, I hope you today and you know I didn't know every now and then again sunscreen. So today at least Dr. Ndotile something say keep this baby face alive. This is Connekt Media Podcast. My name is Bundengese. Thank you so much, Doctor. I hope this is not the last time Yes, there's a lot to talk about. So true, so true. I get it, Doctor.
Yeah, plus now we grew up not knowing that it's a very important thing to use a sunscreen. It's something that we hear about it now, and the earlier, the better.
Thank you so much for watching. Till we meet again, Connekt Media Podcast. I'll happen next time. Dango.